Medical emergencies are dynamic events. The status of a patient's condition can change at any time. Scenes that were initially safe may become unsafe. Patients can become unresponsive or stop breathing during your care. Bleeding that was controlled may start again. The ongoing assessment is the continual observation of patients to identify changes in their condition. As you have seen, the priorities of emergency care are based on your personal safety and the ABCs of patient care. Ongoing assessment focuses on these priorities. Always keep an eye out for any developing hazards. Watch patients for any changes in their level of responsiveness. Ensure their airway remains clear and open, and make sure they are breathing adequately. Recheck wounds to ensure bleeding remains controlled. Watch for developing signs of shock. A patient's condition can worsen at any time. Continue ongoing assessment of the patient until EMS arrives or another first aid provider takes over. Now that you understand the importance of treating life-threatening problems of the ABCs first, let's learn how to care for other, less threatening medical emergencies. Medical problems can be split into two basic categories: illnesses or injuries. Let's first talk about recognizing and treating common problems associated with illness. The human body will display warning signs to alert us to potentially life-threatening illnesses. The major warning signs of serious illness are an altered level of responsiveness, pain, severe pressure or discomfort in the chest, breathing difficulty or shortness of breath, and severe abdominal pain. If you come across a patient who is experiencing one of these signs, you don't need to figure out the cause of the illness. The warning sign alone indicates a need to take immediate action. Activate EMS and get the patient to the next higher level of care. People are often resistant about the significance of their conditions. You may encounter someone who is in denial about being seriously ill. Always communicate to patients the benefits of seeking further medical care and the risks associated with ignoring what may be happening. Many people have medications for existing medical problems. It is never a good idea to give a patient medication that is not prescribed to him. When directed by the patient, you can help him take medication prescribed to him. Now that you know about illnesses in general, let's look closer at the major warning signs of serious illness. A significant change in a person's normal mental status indicates a serious medical problem. Early recognition by a first aid provider and rapid professional medical care is often the best response to a patient with an altered mental state. Many illnesses, such as seizures, diabetes, chronic lung disease, and stroke, can affect the function of the brain and result in a change in how a person acts and responds. Other influences, such as extreme temperatures, poisons, or the use of alcohol or drugs, can also affect the brain.
Kedar, Eniko? Kedar? Kedar? Are you Kedar? How are you doing? Hi, I'm Michelle. How are you feeling? Okay, Kedar, hold on. I'll be right back. I'll be right back. Kim, we have a patient who I think is having a diabetic problem. We need to call for an ambulance.
Sure.
Thank you. How are you feeling now, Kedar? We have some help coming. Just relax. We have some help coming. You're going to be okay.
Hi, we have a man who may be having a diabetic problem. Yes, 4750 Village Plaza Loop. We're in Suite 201, Dr. Lamb's office. Yes. He's conscious. Our dental hygienist is with him now.
Diabetes can create an altered level of responsiveness similar to intoxication due to the imbalance of sugar in a patient's bloodstream. The patient may have a special bracelet or necklace indicating the presence of a medical condition. Giving a sugary substance is the most recognized treatment for a suspected diabetic emergency. However, the most immediate danger to a patient with an altered level of responsiveness is a loss in their ability to protect and clear their own airway. Nothing should be given by mouth to a patient who has a diminished mental status. Activate EMS and provide ongoing assessment of the patient. Seizures also result in an altered level of responsiveness. When someone is actively seizing, your biggest concern is to protect him from further harm. If possible, move objects away and gently support his head. Never tightly restrain a seizing patient. It is dangerous and unnecessary to place anything, especially your fingers, in the mouth of a seizing patient. Seizures generally subside after a few minutes. Once a seizure is over, assess the patient's airway and breathing. Place a patient who is breathing adequately in the recovery position, so fluids will drain from his mouth and not into his airway. It is normal for mental status to improve slowly over time after a seizure. Provide reassurance as he improves. A stroke occurs when an internal problem causes physical damage to brain tissue. Most commonly, a loose blood clot can move forward through the blood vessels of the brain and eventually become lodged in one of the smaller vessels. Brain cells will die from the lack of oxygen due to the blocked vessel. Less commonly, a weak spot, called an aneurysm, can develop on the wall of a blood vessel in the brain. Under certain conditions, the pressure of the moving blood can burst open the vessel wall and send blood into nearby brain tissue, causing brain cells to die. Depending on the location of the affected blood vessel, symptoms can vary widely. There is a simple method you can use to help you suspect whether a stroke may have occurred. First, ask the patient to smile. Then, ask her to hold up both arms. Finally, ask her to speak a simple sentence. If the patient has trouble with any of these tasks, you should suspect the possibility of a stroke. A person who has had a stroke can appear to be confused, yet be clearly aware of what is happening. Always reassure patients with altered mental states and treat them as if they can understand you. Early advanced treatment with specialized medications has shown to be a critical factor in limiting the damage caused by a stroke. Act quickly. Avoid delay when providing care for the patient. Regardless of the underlying cause, your treatment for someone with an altered level of responsiveness is the same. Activate EMS. Make sure the patient is comfortable and provide calming reassurance. Use the recovery position to protect the airway. Be prepared to provide any indicated care as determined by ongoing assessment until he can be turned over to EMS.
Hi, Mary. You wanted to see me?
Yes. Do you have a moment to go over some prices?
Sure. Did you see that presentation I put on your... you all right?
Yeah, I'm fine. I'm just a little bit under the weather. I might be catching that flu that's been going around.
Are you still seeing that heart doctor?
Yeah, but that has nothing to do with this. I'm taking all my medications.
Don't you think it would be a good idea to make sure this is not related to your condition?
Maybe, but I've got a lot of work to do today.
Look, I think it would be a good idea to treat this seriously just in case. Be better to be safe than sorry, okay?
Okay.
Sit tight. I'll be right back.
Gina, could you call EMS? Mary's not feeling well and she's having some chest pain.
Yes, no problem.
Thank you.
Gina's calling for help. Are you comfortable?
Okay.
All right.
Dale,
Yes.
the fire department is on its way, and Chris has gone out in front to meet them.
Thank you, Gina. All right. Just relax as much as you can. I'll stay with you till they get here.
Thank you.
Pain, severe pressure, or discomfort in the chest is yet another warning sign of serious illness that could quickly develop into a life-threatening condition. Although you can't be certain a person who has pain, pressure, or discomfort in the chest is having a heart problem, chest pain is the most common symptom associated with serious problems involving the heart. Other signs that may be present include lightheadedness, shortness of breath, indigestion, nausea, and pale, cool, clammy skin. Women often describe indigestion rather than chest pain as their most obvious symptom of a heart-related problem. Activate EMS. Allow the patient to find a comfortable position and keep her as calm as possible. Stay with her and provide ongoing assessment until she can be turned over to EMS or the next higher level of care.